Hello everyone, this is Dr. John Makoff. Today I thought I would give you some examples of some low back patients, some little cases that I've experienced. A couple that didn't present as low back patients, and as well as two that presented as low back patients, but it wasn't as cut and dry as that. So the first one that came up that I thought I'd give as an example is someone who came in with plantar fasciitis and had been bothering this person for a long time, and he'd been to physical therapists, been to other chiropractors, and just wasn't getting better. So often when people come to me who's been to a lot of people who've concentrated right on that symptomatic area, more often than not, that's not the area that I'm going to be looking at, because it's already been looked at probably by some pretty decent people, and just sometimes the viewpoint is a little more narrow, so I try to open up my viewpoint. So in actuality, with all the different athletes, dancers, runners that I've treated, that I've seen with plantar fasciitis, 75+% of them have been from the low back. So it's understanding that the nerves from the spine, the lower part of the spine, are what feed into the lower extremity of the body. And if those nerves are under tension or are being protected from some trauma, you will find those symptoms elsewhere. So that's what I found on this person. After doing some low back exercises, some McKenzie exercises, some nerve flossing exercises, their plantar fasciitis started to resolve without even touching the foot. I do touch the feet on various people when that's the issue, but it just wasn't the issue in this case. Another patient that came in was someone who had been to everybody trying to fix their neck issue. So again, I'm fine with checking out the neck, and I did check out the neck. I checked out the range of motion of the neck, I checked out the neurology of the neck. There was a few things, but it wasn't that significant, and it wasn't equaling this person's symptoms. Their neck stiffness, their lack of range of motion, their inflammation. But I also know through my experience that the spine has some reflexive connections. And if you look at the spine, if you fold it over, where the upper neck matches the lowest spine, it starts to have what's called in the applied kinesiology world, Lovett brothers. So like the upper cervical spine, C1, has a relationship to the lowest lumbar vertebra, L5, and vice versa. So for this person, we did some experimentation of trying to do some McKenzie low back extension exercises and a few other things to correct the low back, and her neck started to feel better. And so that's where we focused on. It was presenting in her neck. The spinal column is continuous, so majority of neck stuff usually has associations with the neck and the cervical spine, but not always, and this was one of those cases. Another case was somebody who had some low back pain and some disc-like symptoms, and was going to physical therapists, chiropractors, and it was still a nagging pain, wasn't getting better. So I checked it as much as they did, but then I also checked it for the emotional components of it. And I found some deep emotions connected to that low back from muscle testing, and finding that the emotional reflexes took away the muscle test weakness that I found. So I asked the person if we could explore that, and they were okay, and they're like, whatever will help. And so found certain emotional issues, found the origin that we could find with that person, have them think through that, and I actually have them process through that while doing some low back exercises. So we combine the exercises of the low back. In this case, both were like disc area. And disc area, sometimes I do some balancing of ligaments and muscles and other things, but there's also a lot of McKenzie exercises in those type of cases. Sometimes some nerve flossing, sometimes some other muscle activation things. But in this case, it was McKenzie while I had her do the emotional processing. And after that, her back felt like 90% better that day. And so there was a little back and forth a little bit, but as we processed through more, her low back was fine afterwards. Now, the last one I want to talk about is someone came in for a low back and saw a bunch of different people and wasn't getting better. Just thought they needed that special adjustment that some people are looking for. And knowing my neurology, knowing my connections, there's also a thing called cardiac low back. Sometimes your low back starts to feel pain and weakness and give out a little bit because there's an association with your heart. And a protective mechanism that has been found in a couple techniques is that your low back starts to not allow you to keep moving forward and pressing yourself more and more because of the strain it's putting on your heart. And so if you keep ignoring that, you're going to have some more serious heart issues. Now, this could be emotional heart or physiological heart. This case, it was, that I'm talking about currently, was a physiological heart. I've had other ones where it's been the emotional heart. So I brought it to this person's attention, and I found certain reflexes, and some of the muscles in the low back got stronger as we addressed the heart. I told them they should follow up with a cardiologist just to check things out, and they found a little bit when they did. But what we did was we went through the neurology of the heart and started with some quantum neurology, fixing some of the heart neurology and those connections. We addressed certain lifestyle things and as well as some hidden infections, and found some good herbs for them to be on. But and as we progressed, everything normalized, everything the cardiologist found normalized, no medication needed to be on, and their low back got better. But it was sometimes our body telling us to slow down. And if we don't slow down, the body's going to make us slow down whether we want to or not. So those are just some examples that I thought you might find interesting. And if you have any comments or questions, please leave them below or message me. And hope everyone has a great rest of your day. Thanks.